We're going to go now to a major health alert that has a lot of people talking. A shift in COVID-19 vaccine policy is creating a lot of questions and some concerns. The FDA now says annual COVID shots will no longer be routinely offered to healthy younger adults and children. Under the new guidelines, only people 65 and older or those with certain health conditions will be eligible for yearly vaccinations. So what does this mean for families, young adults, and the overall public as we head into the winter months and the fall? And here to break that all down, Dr. Matthew Sims, the Director of Infectious Diseases Research at Corewell Health. Dr. Sims, thank you for being with us this afternoon.
Happy to join you.
So what is the biggest takeaway from the general public for this new FDA policy? Like, who will qualify now for annual shots?
Yeah, so a lot of people are still going to qualify. So anybody over 65, which is one of the highest risk groups, and then anybody under 65 who has at least one condition that makes them at risk for COVID. And I got to look at the condition list. It's pretty broad. It includes things like having been a smoker, being overweight, pretty straightforward things, but also complex medical conditions like cancer, immunosuppression. So it's going to certainly qualify the people we are most worried about getting COVID, the people who still we see in the hospital sometimes really sick from COVID. What it's going to do is take away the people who are young and healthy.
So, Dr. Sims, a lot of the conversation around these shots has been protect yourself to protect somebody else. Like, even if you feel healthy, you could pass it along without knowing. So where does that put us in a frame of mind with, healthy kids, parents, grandparents?
Yeah, it's an important question. One thing to remember, we know that the vaccine doesn't always protect you from getting COVID right now. It protects you from getting very sick from COVID. So the people who are most at risk to get sick are still going to be covered. But yes, we are going to lose those people who the vaccine would have prevented it. We are going to lose that protection potentially. It is a concern.
So you talked about people with pre-existing conditions, maybe former smokers, those people qualifying, would they be high risk?
Yeah, so those are the people being considered at highest risk right now. They raised the question, which is, we developed this vaccine at a different time when nobody had immunity to COVID. Everybody was at risk. We were seeing lots of people in the hospital. And we don't know, is it still necessary the same way it was back then? That's the question we don't know.
So now, as an overall public health perspective, could this move make it harder to control future surges or variants or things of that nature?
It is possible. They are still going to move forward with approving new vaccines or new versions of the vaccine for the at-risk people based just on immunologic data, meaning that they can demonstrate that they will make antibodies to it. That's basically what we're doing with flu right now. That's what we're doing with COVID right now. They're going to ask for a higher level of stringency for people who they don't feel are at significant risk for getting sick from the disease. And that's that they want to see randomized controlled trials to prevent actual symptomatic COVID and to look at, is it going to prevent hospitalizations, things like that. My one concern with that, it sounds like a good approach on the surface. My one concern with that is we know that the COVID virus changes fairly rapidly. We know that when we're not in the middle of the pandemic, it's harder to recruit those sort of studies. And my fear is that by the time you can recruit the number of people needed to prove that it works, the virus will already have changed and now it won't work as well. And so you're going to be on this never-ending treadmill potentially of, can you prove that it actually keeps people out of the hospital, that it actually prevents people from getting symptomatic COVID?
So we'll have some time to see how these new rules will affect us as a whole, Doc.
We will.
Appreciate your time, Dr. Sims. Thank you for joining us.
Happy to.
Important information to be able to navigate that.
Yeah, thanks a lot, partner.